We have got AP and lateral view of the left hip joint and proximal femur. Because the CT scan showed a lytic lesion in the edge of the imaging in the proximal shaft of the left femur close to the lesser trochanter. So what are the findings on the plain radiograph? So here we have got a well-defined ovoid-shaped lucent area situated adjacent to the lesser trochanter in the proximal shaft of the left femur, measuring so and so in the craniocaudal long axis, transverse axis, and AP axis. It shows thick sclerotic margins, which is smooth. The zone of transition is abruptly narrow. There is no bone expansion, no cortical destruction. There is no osteopenia, no soft tissue component, no periosteal reaction. So, based on these appearances, and since the patient is asymptomatic in this region, features are most likely to represent an incidental benign bone lesion. As the lesion is predominantly lucent with sclerotic rim, features are most likely to represent a non-ossifying fibroma. Does this patient need further imaging? I would say no. I'm fairly confident that this is an incidentaloma and most likely to represent a non-ossifying fibroma. As the patient is asymptomatic, I would not recommend further imaging. However, for completion and for medico legal implications, MRI might be undertaken for full further characterization, and biopsy can be avoided at all cost.